For people that are submitting new abstracts out next year, if you could try to keep them within 100 words, it'll shorten our meeting by hours. And with that said, our first talk today is top spine and peripheral nerve abstract, lumbar fusion versus laminectomy for spondylolisthesis, lessons learned from the AANS CNS spine section study, group analysis of the NTQOD registry. Author Michael Virk was unfortunately not able to attend, and Praveen Mummaneni is going to give our discussion.
Thank you, Jim. I want to thank all the study PIs in the NTQOD for contributing patients and for following their patients and making this possible. I do personally have disclosures. They are here. This was a study that didn't look at any particular kind of instrumentation. I would like to mention the study was funded by NREF. And NREF is funded, of course, by member donations, and also, in this case, there was a grant from Medtronic as well. Background on this topic is that there's about 500,000 spinal procedures that are done every year. It cost $12.8 billion in 2011, and the question is there durability and cost effectiveness of these operations? There have been two articles with disparate conclusions on lumbar spondylolisthesis, both in the New England Journal in the same issue. And one suggested that fusion was the better way to go for spondylolisthesis, and the other suggested that it was not. And we wanted to look at this in a real-world registry data type of setting and compare the readmission rates, the reoperation rates, and the patient-reported outcomes in grade 1 spondylolisthesis and patients having decompression alone versus decompression and fusion. So we retrospectively had a cohort. The data that was collected was prospectively collected through the NTQOD. It ranged from July 1, 2014 to December 31, 2015 on grade 1 spondylolisthesis. We picked the top sites from the QOD through the spine section and then analyzed these patients for 30 and 90-day readmissions, 30-day and 12-month reoperations, and we looked at their standardized outcome measures. And what we found was there was 332 patients who had a grade 1 spondylolisthesis that were in these 11 sites. 54 of them had decompression only, 278 had a fusion, so you can see that in the United States these patients tend to have a fusion. We have more than 80% 12-month follow-up on that cohort, and what we found based on the ingoing demographics was that surgeons are likely to select a fusion based on if the patient has back pain. So if they have a back pain dominant complaint, they tend to fuse. If they have a leg pain dominant complaint, they tend to do a decompression. So there is perhaps not perfectly evenly selected groups because some of the patient's symptoms are making a difference. There was also a slight difference in BMI that was statistically significant, and the decompression-only patients tend to be older, and the fusion patients tend to be younger and tend to be working. If we look at the readmission and return to the OR, the thing that stands out is if you have a decompression only, then in 1 year there was a 9.2% chance that you had reoperation at that same level. If you had a fusion, it was very much lower. However, the overall related reoperations within 1 year was not statistically significantly different, but it was higher in the LAMI group than it was in the fusion group. If we look at the reasons for return to OR in the LAMI-only group, 3 had repeat laminectomies for further decompression and 2 were converted to a fusion. If we look at this in the fusion group, there were a number of complications. The number was very high, but the denominator is also very high, so it's 3.9% return to OR in 1 year, and in the decompression-only group, 9.7% return to OR in 1 year. If we look at the patient-reported outcomes, both groups improved nicely from their baseline. And what we can take away from this is that in the real world, in the QOD registry, the patient's complaint of pre-op back pain tends to have them get a fusion. There is no statistical difference in 90-day readmission and 30-day return to the OR between a fusion and a laminectomy patient having spondylolisthesis grade 1. If you look at late return to the OR, it was higher in the decompression-only patients, and when you specifically look at the reasons for those return to the OR, the index level being retreated again in the decompression-only group was statistically significantly higher in the laminectomy alone group, so it seems like fusion may protect some of these patients, but there are issues with the fusion with other complications such as infection, pseudoarthrosis. We'll continue to follow these patients, and I do want to thank all the site PIs for their tremendous work on this study. Thank you.